Hey, I'm Dr. Josh Satterlee from Trust Driven Care. As a chiropractor myself, I've reviewed so much research that talks about how much effect front desk communication can have on the patient care that goes on in the back of every clinic. So I want to share with you today 6 ways that you can improve your communication at the front desk so that it contributes to better outcomes with your patients. The great news is, if you follow these protocols and you use these skills, not only will your patients get better care, but the research is clear. Your office will grow, you'll get more referrals, you'll get more online reviews, and people will also come to you for more reasons, meaning they trust you as their healthcare provider, so they'll check with you before going anywhere else. So let's dive in. The first way you can build trust at the front desk that'll contribute to a growing healthy office is use your patient's name. Now I know you might be saying, oh, that's a HIPAA violation. Stop, it's not. You can just use their first name, and the research is clear. Every study that looked at doctors using the patient's first name saw improved outcomes and improved patient satisfaction. Because we are humans, we love our name, we love to be recognized. So how can you use their name? I recently had surgery, and at one of my appointments, I walked into a pre-op appointment, and I'm on crutches, I'm at the front door, and as I'm walking towards the front desk, the woman says, "Hey, are you Josh?" How did she know that? Because there were a few other patients, but when she lined up the time, the patient history, and the age, because she already had my date of birth, she had a pretty good guess that my name was Josh. When she did that, I was ecstatic. I was like, yes, I am. And she looked at her iPad and said, great, you're already checked in, go ahead and grab a seat. That patient satisfaction inside of me was huge at that point. I would love to be recognized that way every time. Furthermore, it's a great skill to use their name in other ways. Maybe you have a whiteboard on the outside of every patient room and say, this room reserved for Amanda or Steve or Jerry. Whoever it is loves seeing their name as if somebody was thinking about them already. It drives up that patient satisfaction, and we know it improves the outcomes by simply using their name. My second tip for increasing trust at the front desk and helping you get better outcomes and have a growing office is this. The research is clear that we as doctors need to tailor our communication with our patients. We need to adapt to them, not expect them to adapt to us. So we need to use language that works with them and methods that work with them. Well, the most common method that people communicate now is not email. The most common method that people communicate now with their friends and family is two-way text messaging. So if we're going to follow the research and tailor our communication, we should be using two-way text messaging as the primary way of communicating with our patients. It's the primary way that you probably communicate with all of your loved ones. That still allows us to make phone calls when necessary. But why do we keep forcing them to use email? I'll tell you, it's probably because your EMR, your EHR, your electronic health record, your medical software requires emails. If that wasn't the restriction of your software, what method would you likely communicate with your patients? So we here at Trust Driven Care provide two-way text messaging solutions for your office. Love to have you check it out, because two-way text communication is the most preferred method for patient communication when we ask patients. Furthermore, there's been a lot of research. For example, there's research around tonsillectomies where they sent two-way text messages, one before the tonsillectomy procedure, one on the day of, and a message the day after. The patient satisfaction scores were huge, and there was not a single participant in that study who didn't say that the text messages were a positive addition to their patient care. We can get so much buy-in by simply using two-way text message. Now let me give a little caveat. If you say, well, my EMR sends out text messages, but they're one-way, tell me where else we would accept one-way text message communications. I hate it when it comes from my mechanic. I hate it when it comes from the power company. I hate it in every sense of any method of communication, because it's not communication. It's someone else making an announcement to me of which I can't reply to. If you think that works, try it at home for a week and just communicate one direction. Tell me how that works out. The third way that you can build trust at the front desk to positively affect your patient care is ensuring that your front desk communication is clear and helpful to the patient. So what's a way the front desk can build up trust and build a relationship with the patient before they ever show up? Don't rely on them to worry about the medical stuff. Have the front desk staff worry about, is the patient easily finding our office? So if you are already using text messaging, and if you're not, you should start using two-way text messaging, but a great tool to use to build up trust is to simply send a picture of what your office looks like from the outside to every new patient. Remember, you've pulled in the parking lot of your place 1,500 times or more. They pulled in for the first time. If you have a difficult hallway or an elevator they have to use, or if there's a better place to park, send a picture of it and give them those instructions. We're trying to build that relationship with them before they ever set foot in the office. But the research is clear. If we do that, we're going to see better outcomes on the back end. So sending a picture of the outside of your building and telling that person, use this door or use these stairs or don't park in these spots is so helpful for the person when it's their first time. Imagine, I would challenge you, imagine if you were trying to ensure that your grandmother made it to her medical appointment. How much easier would it be if you just sent her a quick picture of what the building looks like? So that's a great way the front desk staff can help build that relationship so you get better outcomes on the back end, all right? So the fourth way that we can build positive relationships at the front desk so that our patients have better outcomes is by setting the tone for what the visit will be like. When a person walks in your office, it's the front desk's responsibility to set the tone how everything else in the office will go. And unfortunately, the most common thing that front desk staff does is set a tone of cold information collection. Not warmth and healthcare, but rather cold information collection. They hand a clipboard of information that needs the same information filled out in 5 different places. This is 2023, stop. Just stop asking people to write their address on 17 different sheets. It's disrespectful because it's saying that their time doesn't have value whereas yours does. Ask for things one time. Look through your intake material and ensure that you only ask the same question once. Now the medical information, it's very important to ask the same question in different ways. But is it really important to ask for the insurance policy name 5 different places or to get 6 different signatures about who's financially responsible? In the end, those things don't matter. What really matters is setting the tone for a warmth relationship. So I would encourage you, trim down your intake as much as you can. At the same time, when you trim down that intake information, people want to feel like you understand them. So there's good research to say collecting information via text message can help build a relationship. The reason text message is so effective is number one, it requires us as providers to cut down frivolous information and only ask the information that's very important. It also allows us to ask those questions in a format that that patient is used to. That text message is how they ask their, girlfriend where they want to go to dinner, or they ask their parents where they want to go this year for vacation. We are used to information collection via text message, but you don't want to send 28 different questions that need to be filled out. Instead, send a few and then use that information to provide better care. But the front desk sets the tone, and if we're not using names at the front desk, that's a negative. That outcome will be worse in the back. If we're overwhelming with asking them to fill out information, the outcomes will be worse. If we're cold, outcomes will be worse. Yet if we're warm, welcoming, use their name, the research is clear that we will see an improvement of patient satisfaction and health outcomes. The 5th way that you can build trust at the front desk to help your patients have better health outcomes and fill your office with more great patients. The 5th way is people want to be understood. Patients want their care to be understood and they want the right questions asked. A great way to do that is with surveys. So if you develop surveys that are specific to patient conditions and they're simplified, a lot of patients will respond positively to that. So if you ask a headache patient, hey, can you fill out some information? What type of headache? What triggers are there? What time of day? When do you notice your headaches occurring? Do they occur on vacation or not? Collecting information like that and then later discussing it builds a bond between the provider and the patient. Now, we don't want to overwhelm our patients with too many questions, but very specific questions to their condition help them feel heard and understood. And it's just like Stephen Covey said, seek first to understand and then be understood. Help those patients feel like they're understood. And the research around autoimmune disease would say that's a huge step in helping those people feel like they are getting care. Unfortunately, in autoimmune disease, the research says that it takes 7 years for doctors to get to an accurate diagnosis. 7 years. That's 7 years of that person going to the doctor and feeling like they're not heard and not understood. It would be pretty frustrating and heartbreaking if that was the case with you. So instead, when somebody says they have a condition, use surveys that you can send out through 2-way text messaging, simply using our software, Send out surveys that collect more information. Also, patients, when they fill out those surveys at home, tend to be more accurate than when they're filling them out in the doctor's office. You can use that for good. That's my 5th way of improving the trust in your patient relationship at the front desk. The 6th way to improve trust in your patient relationship and build and increase and improve your patient outcomes is by using some humility. Humility comes up over and over and over again in the research about patient communication. People cite the fact that their doctors are not humble. So what's a good way to engage in humility at the front desk? Very simple. Acknowledge the patient immediately when they come in and make them the priority, not the front desk staff as the priority. You'll see in a lot of offices when you walk in, the work that the front desk staff is doing is treated as the most important thing in the room, when in fact those patients waiting are the most important ones. Offer water or a snack, welcome them and use their name. These are simple ways to show some humility, but they go a long way with those patients. In fact, the most common reason for malpractice claims has nothing to do with what we do in the back with our patients. It has to do with communication. And if we communicate poorly or in a way that the patient feels disrespected, we often will get sued for malpractice, when in fact it was just a communication error. So if we can be more humble by treating the patient as the most important person in the relationship, we can see an improvement of their health outcomes, we'll likely get more referrals, our office will grow, and we won't get sued. Overall, it's fantastic. So I hope you enjoyed these 6 ways of improving the trust at the front desk. If you're interested in learning more about this, we are Trust Driven Care, and we offer both the tools and the training to have better patient communication that results in better relationships. You can check it out at trustdrivencare.com and book a demo. We'll show you our software. I'd love to show you what we can do.